Ultra-processed foods, the high in fats, starches, sugars, and additives, now make up 73% of the U.S. food supply.
Ultra-processed foods provide American families on a budget with convenient, affordable groceries.
I actually use my entire paycheck on groceries.
But some have been linked to growing rates of disease.
I was unhealthy, I was overweight, I was actually pre-diabetic. It was a wake-up call.
As food technology develops at lightning speed, Americans have to make choices that may risk their health.
How is it that some chemicals that are in our foods have long been banned elsewhere?
America's a country that likes individual choice.
And a growing chorus is calling for more protections for consumers.
Most of FDA enforcement happens post-market. It's kind of like a game of whack-a-mole.
We're taking on a very powerful industry, and I think we have a right to protect our children.
So this is quite overwhelming. This is the largest food and technology show in the world. It's kind of a reminder that what we consume today is just as much a product of technology as it is actual food.
The Institute of Food Technologists' first expo, which stands for Food Improved by Research, Science, and Technology, showcases scientific solutions to the world's food-related challenges, like increasing nutrition, sustainability, and affordability. Many exhibitors provide samples of their solutions, so I dug in. I tried tuna sashimi made out of plant-based ingredients.
It has the texture of like a gelatin, but it does taste like raw tuna.
Meatballs made of half meat and half structured, texturized pea protein.
2 more, please. That was really good.
By going half-half, you can work with conventional consumers who still like the meatballs, still like the taste, but now they have a healthier, more sustainable, more cost-effective option.
And an umami flavoring that can make something taste saltier than it is and keep you coming back for more.
Oh, yeah. It's so much more bold.
And it's 40% less salt.
Wow.
Yeah. Better for your waistline. And your heart.
Yes, but if I'm having 3 times more, 3 times as much of this.
Don't do that. You still have to read your serving sizes.
Right, but the thing is, it's irresistible.
It does add the irresistible factor.
Yeah. Sausage, garlic, and kind of a watery cheese. I'm full.
The ultra-processed food samples I've tried here are the product of the world's latest food processing techniques and ingredients. Dr. Kevin Hall, a senior investigator at the National Institutes of Health, told me that our food today is a technological marvel.
And it's these amazing scientists use this wonderful technology to generate the foods that we see on our shelves in the grocery stores and make really convenient products that are, you know, at least from a microbiological perspective, like pretty safe, right? Acutely, they don't cause us to get sick, and they have long shelf life and don't require a lot of equipment and skill to prepare.
A lot of what we're seeing here is about, as you say, shelf life, but a lot of it is, I mean, ultimately, you don't have a business unless people want to buy more and more of your product.
That's exactly right. So not only does it have to have those properties, they want to have repeat customers, right? Your product has to be tasty and delicious and convenient. Many of these folks are also trying to design new technologies to introduce things into these foods that might actually improve their health. The question is, we really need to understand what that does to our bodies over the long term and how it affects our health.
Yeah.
Cheers.
Cheers.
About 65% of the food products in U.S. households purchased in 2020 were ultra-processed. Families are bombarded with advertising for these products.
There's peach, there's blueberries. We're not gonna get fruit roll-ups, okay?
And their affordability can be more appetizing for those on a budget. Yet only 1 in 3 Americans know what ultra-processed foods are. Dr. Vinjaya Surampundi, a physician and board-certified nutrition specialist, helps me understand.
Ultra-processed foods, they're a whole kind of genre of food that are higher in fat, higher in sugar, salt, some sort of food additives, colorings. They're highly palatable and easily to digest typically.
What is a minimally processed food versus an ultra-processed food? And can you lay out some examples?
Yeah, even buying pre-cut vegetables at the grocery store would be considered minimally processed. Frozen vegetables would be some degree of processing. In the next level, we can think of olive oil or avocado oil, right? We have to press it. Then you're starting to get into, say, yogurts. They're fermented. You'll get some probiotics, but it is a degree of processing. And then finally, we're getting into more ultra-processed foods. They come in a package. They're in the middle of the grocery aisle. They're shelf-stable. Those tend to be more what you think of as an ultra-processed food.
Humans have used basic processing methods like heating, curing, and fermenting for thousands of years. But many advanced techniques used today developed during the World Wars.
Feeding the troops twice a day is a challenging problem.
Shelf-stable food that could weather the elements fed soldiers on the battlefront and addressed food shortages at home. M&Ms were exclusively sold to the U.S. military during World War II because the candy coating prevented melting. A USD scientist invented powdered cheese for soldiers as a swap for perishable dairy products. And by 1948, the Frito company was selling Cheetos. Cheerios, Chef Boyardee, and Spam all became household names and are still iconic food brands today. Additives and processing techniques have evolved dramatically since the 1940s and continue to be developed at places like the North Carolina Food Innovation Lab, where scientists help companies develop food products like this plant-based milk.
We have multiple sources of ingredients going in there that are almonds, cashews, tiger nuts, sugar, and maybe a flavoring compound. And then our pilot plant manager will be chewing all of that up to extract all the nutrients and flavors out of it into a water base. And from there, we'll start filtering the product to make it more liquid in appearance. And then our last step will be pasteurizing, which removes all the pathogenic bacteria.
Raising the nutritional value of ultra-processed foods is a challenge the Food Innovation Lab and others are trying to tackle. Studies have found that people who ate a diet high in some ultra-processed foods were more likely to have poor health outcomes, like loss of kidney function, wheezing in children, and diabetes. But they have not proven ultra-processed foods were the cause.
This is all from local farmers.
This stuff looks good.
We have zucchini,
Called like squash.
Squash.
red peppers, avocados.
Is it confusing going to the supermarket?
It can be a little bit difficult. It can be kind of hard trying to figure out what's healthy and what's not.
It will boil down to either you're going to pay for that convenience for the fast food, or you're going to end up paying more money for prescriptions.
2 years ago, Crystal Cawley's then 13-year-old daughter Tiara Channer was diagnosed with prediabetes, a condition 1 in 5 American kids face. It put her at increased risk for type 2 diabetes, chronic kidney disease, and cardiovascular disease. Crystal and Tiara blamed the diagnosis on their poor diet.
She actually had to have a neurological consult because she felt the tingling and the different sensations, and it was all linked to prediabetes. So it was a wake-up call, but she took the challenge to do better.
So how has your health changed since you've made these dietary changes?
It has changed drastically. I lost around like 50 pounds.
50 pounds?
Mm-hmm.
What was the diet beforehand?
Well, fortunately, it dealt with a lot of convenience and places that aren't healthy.
A lot of fast food.
Mm-hmm. A lot of delivery.
So you've cut that out completely?
I have personally since April of this year, and for her, it's been 1 year.
Your child is holding you accountable too.
Yes, she is.
Yeah.
Mm-hmm.
We've got an epidemic, and that epidemic of obesity and kids being overweight absolutely leads to a radical increase in the number of people with diabetes. And it's not only diabetes, it's other related illnesses. So keeping kids healthy and away from ultra-processed food, unhealthy food, enormously important for the well-being of our people.
In a free market, can large food companies be held responsible or culpable for
That's a great
the
question.
choices?
That's a great question, and the answer, I think, is yes. And, you know, we learned something in terms of what Congress did 50 years ago. The Congress had the guts to say to the tobacco industry, very powerful people, sorry, you can't cause hundreds of thousands of people to die every year by enticing them to smoke. And as a result of that and other public health measures, by the way, we have reduced the amount of smoking in America very significantly.
You see the food industry in some ways akin to big tobacco decades ago.
Absolutely. And in fact, their strategies and their tactics are akin to big tobacco.
What's the cost to society?
Diabetes itself, I think, is running up a cost in healthcare dollars of some $400 billion, unless we get a handle on this issue, that it will grow. So bad food, obesity, diabetes is a very expensive proposition for the American people.
The responsibility of regulating foods falls mostly in the lap of the Food and Drug Administration, which regulates about 80% of the American food supply. I spoke with the FDA commissioner to learn how they do it.
How does a new additive, a new chemical that's not been on the market, get introduced into our food systems? And what role does the FDA play there?
If someone wants to add something to food, they have to petition the FDA, and the FDA has to consider the evidence about that substance. There's a term called GRAS, and in order for something to be qualified as GRAS, there has to be a consensus of the scientific community and the evidence that it actually is safe.
GRAS substances are food additives that are generally recognized as safe. The designation was created in 1958 to waive FDA review of common, time-tested ingredients like vinegar and baking soda. Companies could petition the FDA to have a substance added to the GRAS list. But in 1997, the FDA loosened the protocol, allowing companies themselves to declare substances as GRAS without notifying the agency. Experts like Emily Broad-Leib, director of Harvard's Food Law and Policy Clinic, says this creates a loophole that gives companies a provisional green light.
Thousands of substances have entered the food supply during that, using that mechanism. And again, FDA can always afterwards say something is no longer generally recognized as safe. They've done that with artificial trans fat or partially hydrogenated oils. But there's so many substances that, you know, it really is, I think, challenging given the resources FDA has to really be on top of that all the time.
The Environmental Working Group, a nonprofit, found of nearly 800 food chemicals introduced between 2000 and 2021, 99% of them avoided FDA scrutiny using the GRAS designation. But the number is likely even higher. It doesn't include the unreported declarations.
GRAS is a pathway that many companies have used the vast majority of times, as opposed to petitioning.
We're looking at every aspect of what we do. And as we've just discussed, there are laws that govern these patterns of how one gets things on the market and how they're regulated and then evaluated. I think in this era of technology, there's going to need to be a change in how we look at these issues.
One report estimates the number of chemicals approved for the use in U.S. food to be around 10,000 as of 2011, nearly 5,300 FDA-approved additives, and more than 4,600 GRAS substances. In comparison, their European Union has only approved over 400 additives and does not have a GRAS equivalent.
How do we account for that disparity, and how is it that some chemicals that are in our foods have long been banned elsewhere?
Different societies have different degrees of tolerance for uncertainty and different laws that determine what the regulators can do as substances are added. America's a country that likes individual choice and access in general. And I think our laws reflect that sort of national sentiment.
The FDA says it is committed to overseeing the safety of the food supply and takes action when new research shows an additive causes harm. The agency is working on updating its system for assessing food chemicals as part of a larger project to enhance food safety measures. The public will have input, and so will federal scientists working to understand how ultra-processed foods affect us.
I work for the government, right? I'm a federal government employee. We invest in research to better understand how these foods are affecting our health, how they affect our food intake behavior.
At the NIH, Dr. Kevin Hall and his team are studying the links between ultra-processed foods and metabolic disease.
Our colleague here will help measure your resting metabolic rate, the flow of your respiration, and how much oxygen your body is consuming, how much carbon dioxide you're producing, and the idea is to be as still as possible. Don't fall asleep, but we'll measure how many calories your body is burning at rest when it's not doing anything.
So do nothing is
Do
my
nothing,
job.
but don't fall asleep.
Okay.
That's your job.
Okay.
Okay.
That is an easy task for me.
All right.
This is one of many instruments Hall used in his influential 2019 study, the first to scientifically link ultra-processed foods to obesity.
This is oxygen consumption, and this is resting energy expenditure in calories per day.
His team housed 20 participants in the NIH Clinical Center, taking full control of their diets. They were fed ultra-processed foods for 2 weeks and minimally processed foods for another 2 weeks. Each diet contains similar nutrients, allowing the team to focus on how the act of processing foods influenced how a person eats.
On average, when these same people were exposed to the food environment that had a very high percentage of calories from ultra-processed foods, they ate about 500 calories per day more, or averaged over 2 weeks, as compared to when the same individuals were exposed to the diet that had no ultra-processed foods. And if we could better understand what the mechanisms of excess calorie intake are in ultra-processed foods, then we would be able to provide our colleagues in the food industry with that sort of information.
In his latest study, Hall's team is trying to pinpoint those mechanisms. One of his theories is that processing food reduces its water content, so it takes more to feel full. Another is processing just makes food tastier, so people simply eat more of it.
I think that there really are healthy ultra-processed foods. I think that there are others that are not healthy. We just need to figure out which ones those are and how to give our policy friends the advice on how to limit intake of those kinds of foods.
But even once researchers have new information for policymakers, the FDA says it can only do so much.
As written into the law, the FDA is more like a referee than it is like the owner of the team. If you think in a sports analogy, the rules are written by Congress and dictated by the executive branch of the government. And what the FDA does is to take those rules and then apply them to make decisions based on the rule book. The FDA has really got to modernize. We have a lot of people that are capable of doing it. But again, we can't step beyond the rule book. One thing about the FDA is we follow the law, and the law is not written by us.
FDA, USDA, there's things they can do, but a lot of it is really getting the signals from Congress, which is the big guns that hold the purse strings to kind of make all of this change happen. And I think it doesn't always rise to the top on the political agenda in the way that it really should. We're getting the signals that this is important to people, and it would be great if more people sort of made that apparent to particularly elected officials that they want to see that change, because I think that's where a lot of that logjam is.
We have allowed large corporations in the food and beverage industry to entice children to eat foods and beverages loaded up with sugar, salt, and saturated fat, purposely designed to be overeaten.
Senator Sanders is co-sponsoring a bill that would, in part, require the FDA to implement stronger health warning labels on foods, restrict junk food advertising to children, and direct the NIH to expand, intensify, and coordinate research programs on nutrition science, including on the chemicals self-affirmed by manufacturers as generally recognized as safe.
Does the FDA have to play a bigger role in policing what makes it to market?
I think that's a great question, and I think the answer is yes. There are so many new additives. Every day, new products are coming onto the market with stuff that we are not aware of in terms of its long-term impact on human life. So I think, yes, I think the FDA has been negligent, and I think we want to make sure that they're more aggressive in reviewing the products that are getting onto the market.
Well, and they say that it would take Congress to act.
Well, then I think Congress should act. But I think there is a growing awareness in the medical community and in the general public that we cannot continue to allow our kids to be addicted to processed foods, get sick, and die at an earlier age than they otherwise would. So the movement is with us. We're taking on very powerful special interests, but we are gaining every day.
There you go. Thank you. Have a good day.
Back in Hendersonville, local organizations are trying to get more whole foods to kids. The public school district delivers free, healthy meals in local parks during the summer.
Feeding 4 kids is, it's not easy. It's a struggle financially.
Sure. So this is
is
helpful.
really nice. Oh, yes, definitely. Yeah, definitely.
What do you think about the meals that they get?
I think it's great. They usually get a fruit and sometimes a vegetable. Yeah, fruit and vegetable, and then some kind of
I
protein.
see no one's eaten their broccoli yet.
And the nonprofit Caja Solidaria, funded through a state Medicaid waiver program, delivers fresh produce to people's homes, like Tiara and Crystal's.
Eating better, we're preventing a lot of the issues that run in the family, like cardiovascular health issues, diabetes. And so she's making choices that will definitely impact her future. And so she's been very inspirational.
You must be very proud.
I am.
Across New York Harbor from the Statue of Liberty, this rooftop farm offers immigrants a taste of home. Residents shop for vegetables at the Brooklyn Grange Weekly Market, part of an effort to improve the health of older Chinese Americans in the Sunset Park neighborhood.
There are lots of packaged and processed foods within the Asian food system that are built around cost and convenience, just like in the American food system. These are cucumbers.
Dr. Stella Yee is an associate professor of population health at NYU Langone.
There is a myth about Asian Americans being healthy. When it comes to obesity, Asian Americans are always the lowest obesity prevalence. But when you actually start to look at some of the outcomes at smaller body sizes, Asian Americans tend to be at equivalent risk for some of those cardiometabolic conditions as other racial ethnic groups.
Dr. Yee partnered with the Brooklyn Grange to offer subsidized, heart and gut healthy local produce.
So for the older Chinese Americans who are on limited incomes,
Yeah.
what is their access to foods, healthy vegetables?
New York City does a great job of having this really robust charitable food system, but the products are not necessarily culturally appropriate. There are things that are being left behind, like canned tomatoes or acorn squash. It's not because they're ungrateful or because they don't need it, it's they literally don't know how to prepare it.
The Grange harvests bok choy, Chinese broccoli, and Asian eggplant, and other crops that help John and Vivian Kwa add more vegetables to their meals.
Tell me about the vegetables and what you think you're going to do with these.
Zucchini, we usually do it on the barbecue and cut it in half and then use soy sauce and then some salt. It'll be delicious.
My sugar has dissolved.
At a pickling workshop, Winnie Kwan learns how to preserve varieties of vegetables familiar from her early years in Hong Kong. Kwan is active and health conscious, but like so many Americans, succumbs to cost and convenience.
You've been here for 30 years. Do you think that it's become easier to find junk food?
A lot.
A lot of junk food.
A lot of junk food, yeah.
It's hard to avoid junk food.
Back home, Kwan prepares herself a healthy feast of shrimp with cucumber and curried chicken with potatoes.
I eat slowly and enjoy it, but I eat a lot. I eat a lot.
It's not just about access to bok choy or various types of produce.
Yeah, exactly. It's like one bite of food you can transports you back to being like a 5-year-old kid. I really wanted to try to capture some of that for the folks that are participants in this program, to say how great is it that they're growing it here in Brooklyn for me.
A community now firmly grounded on American soil, planting the seeds for a healthier life. For CBS Saturday Morning, I'm Adam Yamaguchi in New York.
Crust is caramelization.
Whether he's serving up the many varieties of French toast at Chicago's Batter and Berries restaurant,
Blueberry, strawberry, caramel, and lemon.
filming cooking classes in his home kitchen,
So today we got fish and a mystery fish.
or showing families how to adapt those recipes at home.
Hello, 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 hello. Welcome back for another fun-filled segment of Let's Eat Right.
Chef Ken Polk mixes humor and nutrition science to infuse cooking with joy.
You can chop it, you can chunk it, you can think it, you can thunk it. It's all going right in here.
In a church basement on Chicago's South Shore, Polk works with the University of Illinois Chicago to change the food landscape.
Cooking is about hearing, as well as feeling, as well as smelling. If anybody in the room has a question, please ask, because the more you know, the more empowered you are, the better off your life will be. Ta-da.
In this neighborhood, food insecurity and rates of diet-related death are about 50% higher than the city average. Professor Saria Lofton says lack of food options is partly to blame.
And so you'd have a lot of convenience stores that had highly processed foods.
And the health outcomes that you were seeing in those communities look like what?
Well, we have higher rates of hypertension, higher rates of diabetes, cancer rates.
Each participant in the university's Food is Medicine program takes home a bundle of fresh produce.
Mimi.
Back in the teaching kitchen, the chef's amped-up show and tell entices even the youngest chefs to pitch in.
It's time to Lego my ego. Who wants to crack some eggs? Me! How did I know? So for French toast, we're gonna use something really, really simple. French bread. Does that make sense? All right, here we go. We're gonna go in, dip, baby, dip. All right, and down we go. 1, 2, buckle my shoe. There we go. Who's cooking sausages?
Next up, a breakfast staple, minus the heavy processing and additives.
At the restaurant, we only use chicken thighs, but this one's gonna be a mixture of thigh and breast. Take a scoop, drop it like it's hot. Let's go to the skillet. To the skillet!
Nothing on here is unpronounceable.
Because if you pronounce it, you can make it. Because you ain't got to go into the store trying to find xanthan gum.
So how do you guys feel about what you made today? Good? 2 thumbs up.
I learned just like, okay, I don't have to put all this salt in the food to cook it.
After more than a year of monthly classes, Ashia Smith says her blood pressure has stabilized.
To be able to stop having to take blood pressure medication, that's a big
It's
deal.
just a big deal. It really is. I got a young son.
Yeah.
It's my youngest kid. So we want to break the cycle.
Right there.
You are instructing people like me, who don't really know their way around a kitchen, to cook better. What are you getting out of that?
I want people to live better. How you eat determines how you live. Period.
The heat was on as Polk schooled me in cooking basics.
One of the simplest dishes, scrambled eggs, is something that has eluded me for as long as I've been in the kitchen.
Shake, stir. Now pull.
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 North, south, east,
North, south,
west.
east, west. Shake and stir again.
This is better than anything I've been able to achieve at home.
You've earned that egg, brother.
Something this simple makes me want to do this more often.
Yes! Oh boy.
That is amazing.
Oh man.